solution. I'm meteorologist John Weatherby.
The views expressed on the following program do not necessarily reflect the views of Money Radio staff, management, or advertisers, and do not represent an offer to buy or sell any securities. Some interviews heard on this program may be sponsored by the participants. It's time for Health Futures with Cypress HomeCare Solutions, Bob Roth. This is Arizona's only show dedicated to providing you with expert advice on how to live a longer, healthier, and happier life. To learn more, call 602-264-8009. That's 602-264-8009. Now, here's your host, Bob Roth.
Good afternoon. You're listening to Health Futures. I'm your host, Bob Roth. And happy Friday to you. It's hard to believe that this is the last Friday of the month of October. Where has this time gone? We're coming at you live from the Scottsdale Air Park. And you can catch us on 1510 AM, 99.3 FM, or the World Wide Web at moneyradio1510.com. If you're just tuning into the show, Health Futures is a show about how our older adult population can live a healthier, happier life. And Cypress HomeCare Solutions is a company my family owns, and we provide home care givers into the home to enable people to stay at home and age successfully in place. And now that we're at the end of October, next month we're going to be celebrating National Family Caregiving Month. And there are millions of people that are out there making the ultimate sacrifice, helping their loved ones age successfully in place. So the secret to our show is bringing great guests. And today is no different. I have a guest that's across from me who is from United Healthcare, Medicare, and Retirement. Her name is Melanie Heffelman. Melanie, welcome to the show.
Hi, hello. Thanks for having me today.
Well, thank you for being on the show today. And this is a great time of year for us to be really talking about health insurance. And we're not going to talk about the Affordable Care Act and Obamacare, whatever you want to call it, but we're going to talk about Medicare. And right now it's open enrollment, correct?
It absolutely is. We are smack dab in the middle of it.
And United Healthcare is probably, if not the largest, one of the largest providers of healthcare services, or health plan, if you would, in our state, correct?
That is correct. We actually insure more people here in the United States than any other carrier.
Wow. That's an incredible testament to the work that you guys do. And today, we want to talk about open enrollment, and there are roughly about 352,000 people that are beneficiaries to United Healthcare plan.
Right. So we have about 10,000 people a day that become eligible to participate in Medicare in the United States. And here in the state of Arizona, United Healthcare has about 130,000 members that we provide services to. And our job is really just to help these people live those happier, healthier lives.
So now that it's election season, and I'm not talking about the presidential election because, trust me, that is burning up the airwaves on the radio and on the television, as well as, in the news, digitally, or in the newspapers. I'm talking more about healthcare election. So really, people that turn 65 have this option to go ahead and register for Medicare benefits. And if you miss this window, you are basically out for the entire year, correct?
That's correct.
So, tell me about what is involved in registering for Medicare.
So open enrollment, like I said, we're in the middle of it right now. It runs through December 7th. And this gives our senior population an opportunity to choose their health plan coverage for the following year in 2017. So it can be, do they want to stick with original Medicare? Are they looking to enroll in a Medicare Advantage plan that would be offered by private carriers like United Healthcare? Are they interested in certain networks with certain providers, certain hospitals? So it's really about taking control of their health care and making sure that they ask the right questions to choose the right plan for their health needs for the upcoming year.
So it's very confusing. It really is.
It is.
And my question to you, Melanie, is what can United help members or potential members learn about registering for healthcare, for Medicare? I mean, there's a phone number to call.
Absolutely.
Right. So what is that number?
The number is 1-800-UHC-6509.
Okay.
And we also have a website for those that are tech savvy. They can hop online to www.uhcmedicareplans.com, and that can help them to answer the questions specific to the plans that United Healthcare offers.
And I just went out to the website, and I will tell you, this is clean. It's real easy to read. And, you have some boxes here that are listed right under where it says what types of plans does United Healthcare offer. And it lists the Medicare Advantage plans, the Medicare Supplement Insurance plans, the drug plans, and special needs plans. Medicare Advantage plan is something you can sign up to, right?
Absolutely.
Tell me a little bit about the Medicare Advantage plans.
Sure. So Medicare Advantage is also known as Part C. So it is really our all-in-one care plan for our members. So we have Part A, Part B, and Part D generally rolled into that Medicare Advantage plan. So it is convenient in that it's one card that's going to take care of all of their health plan needs. So currently in Arizona, we have about 4 out of 10 people that are choosing to enroll in that Medicare Advantage plan just because of the convenience of it.
So it wraps A, B, and D into this one plan called C, which is Medicare Advantage plan.
Correct.
You talk about moving parts.
Right.
Melanie, there's a lot of moving parts to this.
There is. I learn something new every day.
Oh, I'm sure you do. And the website offers a lot, and you gave me a phone number. Are there people that you can call and ask questions or resources
Absolutely.
to go to? Because I'm confused.
Absolutely. Yeah.
And I'm not 65 yet. I can only imagine if I was turning 65.
Sure. So that 1-800 number I gave, the 1-800-UHC-6509,
Yep.
you will get an opportunity to speak with one of our customer service reps who can answer any questions that you might have specific to our plans. If you're looking to get in contact with an agent who you would like to then use to enroll into a plan, they can get you in contact with one of our United Healthcare agents who can also answer your questions, perhaps a little bit more deeper specific to perhaps the county that you live in, maybe a specific provider that you're looking to go to.
And I want to put that number out again. And I love the fact that you've labeled it utilizing letters that are synonymous with the name UHC. Mm-hmm. But I'm old school, so I like numbers. So I want to give it out. It's 1-800-UHC, which is 842-6509, and it's nice to know. And they answer that phone 24/7, or is it normal business hours?
It's going to be 8 to 8 local time.
8 to 8.
Mm-hmm.
All right. And for those that are listening here in Arizona, we don't change our clocks for daylight savings time. So 8 a.m. to 8 p.m., and you have till December 7th. So tell me a little bit about yourself. You are in the health plan business. How did you get into this business?
I actually have grown up in a health-oriented home. My father is an OR nurse, so I grew up watching surgeries on TV. I went to school originally to go to medical school with a plan, so I have a sports medicine degree.
Nice.
Then I started thinking about, I really like nutrition, so then I went back and got a dietetics degree. And I started with Optum, which is a division of United Healthcare, about 6 years ago in our wellness program. So I was writing diet and exercise programs for people with diseases,
right.
Be it diabetes, heart disease. So I've always had an interest in health. And a couple years ago, I came over to the Medicare and retirement side, and I've been working with the health plan since.
Well, it's interesting because you and I both know. I mean, you've been around this business called healthcare all your life. And it is moving at a rapid pace, and it is evolving and changing every day. And, United Health Plan, as you shared with our listening audience, is the number one carrier in the country in terms of covering a number of lives. So, I mean, we are moving down this road, if you would, at a rapid pace. And it's nice to know that United Healthcare is out there leading the charge. But, some of the stuff that you are passionate about, diet and exercise, are so important as it relates to successful aging. We talk about that here on our show all the time.
Absolutely.
I know we're coming up on a break because I want to pick up a little bit on that and talk about that and talk a little bit more about United Health Plan and Medicare enrollment. And the deadline is December 7th, and we never want to lose sight of that because once you miss that, it's over. You got to wait one more year. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth, and I've got Melanie Heffelman from United Health Plan in the studio. We'll be right back.
The money talk you love, still on 1510 AM, and now 99.3 FM.
High returns on your investments? Who wouldn't want that? This is Sinclair No, with a strategy that could increase your overall return on your investment portfolio. It's called Decadian. The Decadian investment methodology encompasses a 10-year goal for financial freedom, plus something that's really missing today, straight talk. So you know you have a financial advisor you can trust. Great investment recommendations that far exceed what your institutional markets offer. All this wrapped with performance guarantees. Only those who know what they can do will guarantee what they can do. Decadian. Decadian.com. Decadian. That's Decadian.com. Call 844-332-2342. 844-332-2342. Here for you when you need it most. Decadian.
I want to let you in on a secret. Flipping apartments and duplexes is easier and more profitable than flipping single-family homes. Yes, the art of buying and selling duplexes, fourplexes, or bigger is easier and more profitable than trying to flip a rundown house in a bad neighborhood. Come spend a day with John Dessauer, the nation's leading multi-unit housing expert, and we'll show you how to put tens of thousands of dollars in your pocket over the next 90 days with no money down, no credit, and no risk. Call 800-981-9930 to secure your seat at one of the 3 convenient dates in the Phoenix area. Become the expert in the art of the multi-unit deal. You'll learn how to buy, hold, and sell multi-unit properties with no money down, no credit, and no risk. This class is worth thousands of dollars, but free to the first 30 people to call. You risk nothing, but have everything to gain. Call 800-981-9930 to secure your seat. This class is free to the first 30 people to call. Change your life now and learn the art of the multi-unit flip with no money down. Call 800-981-9930. That's 800-981-9930. You don't want to miss this. Call now.
Your one blood donation can help save the lives of up to 3 people. Give blood through the American Red Cross to help hospital patients. Call 1-800-RED-CROSS or visit redcrossblood.org today.
I'm Bruce Vail with Your Money Now. The Silicon Valley startup Soylent, which is trying to change the way people eat, has temporarily stopped selling its powdered meal replacements and food bars after some people reported getting sick after eating them. Earlier this month, some customers reported becoming ill after eating Soylent bars, and yesterday the company said its powders are making people sick as well. The company said it is working to uncover the problem, but is halting sales as a precaution. Shares of biotech Amgen are down almost 10%. The company reported third-quarter financial results that beat expectations and raised its profit outlook. However, Amgen kept its sales outlook virtually unchanged. The broader market turned negative today after the FBI said it was reviewing newly discovered emails in the Hillary Clinton server case. The Dow Jones Industrial Average has back on the plus side now. It's up 9 points, but the NASDAQ Composite is down 25. That's Your Money Now.
I've been teaching organic chemistry for the last 17 years, so I'm pretty good with complex calculations. But when I started thinking about my retirement, I was pretty stumped. Luckily, I have TIAA as my financial partner. Together, we retrosynthetically analyzed my financial future, which is organic chem speak for we figured it out.
Your personal success takes a financial partner who values it as much as you do. Learn more at TIAA.org.
This is an alert. If your business or church is building this year, you're about to pay more than you should. This could mean thousands of dollars more for your office, retail space, church, or warehouse. A General Steel building can save you as much as half the cost and time of similar conventional construction. And we're offering rebates of up to $20,000 to help you build today. Call General Steel for free information that could save you thousands. Call 866-95-STEEL. 866-95-STEEL. That's 866-95-STEEL.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress HomeCare Solutions, Bob Roth.
Welcome back. You're listening to Health Futures. I'm your host, Bob Roth, and if you're just tuning in, we're on our second segment. I've got Melanie Heffelman from United Healthcare, Medicare, and Retirement in Arizona here in the studio. Our first segment, as well as about 130 to 140 others, are up on our website at cypresshomecare.com. Melanie, I want to jump back into it. We were talking about how healthcare is really changing, and we and the paradigm that we used to be in, it was more sick care. And now we're really looking at wellness and health and taking good care of us. And I'm going to just tell you, as the host of this show and being in the healthcare spectrum, it's really nice to have somebody like yourself in the space because you understand diet, obviously, being a dietitian, and sports medicine and being healthy. And I know a lot of the health plans are working towards that in terms of making sure people are healthy and living healthier lives than we have in the past. And in order to live a healthier life is being able to have access to health care and making sure that, we are taking care of, obviously, the mind, body, and spirit. And United Healthcare has open enrollment, not United Healthcare, but Medicare has open enrollment December 7th, and we've been talking about that. But, one of the things that, we didn't really talk about in the first segment, and I would love to talk about it right now, is, as I said, it is so confusing. There's just so much out there. There's Part A, B, C, or D, and you can do C and be a part of all three of them. I would love for you to share with our listening audience some questions. If people are tuning in right now and they're 64, about to turn 65, or have turned 65, and open enrollment is now going to be December 7th, what are some of those questions that they should be asking?
Sure. And you nailed it. It's prevention is the best medicine. So we really want to focus on keeping people healthy and happy so that their insurance isn't something that they're constantly worried about.
Right.
So with asking those questions, I want people to focus on remembering that they have a choice when it comes to selecting their health care. Asking about their current plan. Is it meeting their needs? Has their health care changed? Are they maybe taking some new medications that might change in cost or expense to them? Making sure that they really dive into their plan and their coverage and ask those questions. Then we want to think about the care that they're receiving. Do they feel comfortable with the providers that they're working with? Maybe there's a specialist in their area, like a cardiologist, that they want to be able to see. Or even if, God forbid, they have to go to the hospital, what hospital is it that they would like to receive care at? All of these are topics that we really want to focus on because you have that choice, you have that care, and then lastly, the experience. What kind of experience are you receiving when you think about your health plan? When you have to call and ask a question, are you dreading making that phone call? Or do you know that you're going to get a real person on the phone in less than 1 minute to answer your questions and get same-day service right then and there?
So, you said a real person on the phone. You open it up to me. So
real person.
Are you getting real people?
You're getting real people.
And they respond within a minute of the phone call?
Yeah. Oh,
okay.
yeah.
Okay.
I actually go out to our customer service center. They are in Texas.
Okay.
So they are here in the States. Great people, very friendly, and they have a direct line to myself, my team, and we do all that we can to keep it simple.
And it's interesting. You brought up the fact, and I think all of us, and some of us that are disenchanted with the Affordable Care Act, we want to use our providers. And it's nice that, you just said, questions to ask is what providers are on that list. And I mean, United Health Plan or healthcare is one of the healthcare plans that is the largest. So they probably pretty much have most of the providers on there. You can go to any hospital, right?
Sure. In an emergency, 100%.
Right.
Get the care when you need it. United Healthcare has been in the Medicare business for over 30 years. People recognize our name. Providers want to work with us because they can trust us. They know that we are going to keep our word and we're going to really try to support the needs of our members the best that we can.
Nice. Oh, absolutely. Really awesome. And, the advice that you would give people to help, narrowing the process and choosing the right plan, what would you say, other than asking these questions?
Check your resources. Go online, make phone calls. If you want to explore maybe outside of United Healthcare specifically, you can go to Medicare.gov. Mm-hmm. You can go to Medicare Made Clear, which is also a great website because it does exactly what it says. It breaks it down and it simplifies it for you so that you can understand it. It takes out the insurance lingo, we'll say, so that it is easy to be absorbed by our members.
Layperson's terms.
There you go.
There you go. It's hard to believe that these segments go by really, really fast. And I would love for you to, give some final thoughts, tips that you could, convey to our listening audience as they go down this path of open enrollment. One, you want to make sure you put this date down in your calendar.
December 7th.
And you have till midnight or 11:59 p.m.?
Correct.
Is that Arizona time?
Correct. Local time.
Okay, local time. Give, some final thoughts in terms of, this process that they need to go through.
Don't be afraid to ask questions. Medicare is not a one-size-fits-all business. And so what are your specific needs? What are you looking for that's going to help you feel comfortable with your health plan? And I guarantee you there's somebody out there that can help to provide that for you. If you have no budget, if you have a small budget, we can absolutely help you to find a plan that would fit your needs.
And really, the Medicare Advantage plan, as I understand it, I mean, that's the biggest part in terms of a budget. It's going to cost you a little bit more money to have the Advantage plan, correct?
It will, but the thing that's really great about it is that we do have the out-of-pocket max associated with that, where your original Medicare is going to cover 80%, and you, the member, would be responsible for that 20% remaining, and there's no cap to that you could spend within the year.
Nice. And, it's really nice to know that this benefit is out there for so many older adults that are turning 65. And like you said, $10,000 a day. Yeah. I've shared it here on our, with our listening audience before. I mean, the crazy thing to think about is that, 2/3 of this world's population, and I'm talking about Mother Earth, that has lived to the age of 65, is alive today. Mm-hmm. It is alive today. And to realize that, we are changing healthcare, and it is changing by the moment. And it's not your fathers or mothers, or it's not your grandfathers or grandmothers. It is changing and it is evolving. And as we talked about in the last segment, we talked about at the beginning of this segment, it's about really improving quality of life. And a lot of the training that you did, education-wise, I think you told me you went to Colorado, right? Or
Colorado State. Don't you call me a buffalo.
All right. But the one thing we did talk about at the break is that you're a Horizon Husky.
I am.
So you're a local here, born and raised, and moved back to Horizon Husky territory.
I did.
That's where my kids went. So, kudos to you. I will tell you, Melanie, thank you for being on the show. And I want to give just a real quick shout-out. If you have any questions, go to 1-800-842-6509 or go to uhcmedicareplans.com. Make it a great day. We're at halftime. I got Dr. Troy Comstock from Optum coming up next. We'll be right back.
As we reach the bottom of the hour, we pause for a look at the world's news. Then we're back with Money Talk. We're Money Radio 1510 and 99.3 FM.
Special report, the FBI reopens Clinton probe. The FBI is looking at newly surfaced emails from a case not related to Hillary Clinton's and told Congress they appear to be pertinent to the closed investigation. Correspondent Phil Mattingly reports the Clinton campaign seemed caught off guard.
Obviously, this was quite a surprise. Her most senior advisors were all on the plane with us. Her campaign manager, Robert Muck, her communications director, Jim Palmieri, Kuma Abedin, her very close advisor, were all on that plane that did not have Internet access.
The New York Times and CNN are reporting the new email surface after the FBI seized the electronic devices of Anthony Weiner and his wife. Donald Trump reacted to the reopening of the probe at a rally today in Manchester, New Hampshire.
Hillary Clinton's corruption is on a scale we have never seen before. We must not let her take her criminal scheme into the Oval Office.
I'm Ann Cates.
In my line of work, I'm trying to make a difference. Not $1 billion, but I want to save for the future, too. So this year, I partnered with TIAA to help me map out a plan. If I stick to it, I could have an income stream for life and maintain my lifestyle in retirement. Looks like a life of rewarding work could pay off for a lifetime.
Your personal success takes a financial partner who values it as much as you do. Learn more at TIAA.org.
Ace is a place with the helpful hardware, folks.
I need to switch to LEDs. I told Brad some of our LED light bulbs are on sale for less than $2 per bulb.
Ace is a place where you can save money when buying LEDs and save energy and the environment. It's a start.
Head to Ace now through Monday and get a 3-pack of Fight 60-watt LED bulbs for $5.99 with instant savings. That's less than $2 per bulb. Offer valid through October 31st at participating stores. Ace Rewards members save $1 instantly in store. Store stock only. See store for details.
If you've recently made the switch to Money Radio, first, thank you. And second, we'll work hard to keep you with us as we talk about all things relating to money. We want you to make more of it and then keep it for whatever. There's more advice on the way from Money Radio 1510 and 99.3 FM.
Sharing the financial responsibility as a couple can be a challenge. That's why it's important for couples to communicate about their finances. Learn things every couple should know when saving and preparing for retirement on this week's My Smart Retirement with certified financial planner Nancy Fleming. What should you be doing with your spouse in order to have a successful retirement? Not sure? Then tune in this Saturday morning from 10 to 11 for My Smart Retirement with CFP Nancy Fleming right here on Money Radio.
I want to let you in on a secret. Flipping apartments and duplexes is easier and more profitable than flipping single-family homes. Yes, the art of buying and selling duplexes, fourplexes, or bigger is easier and more profitable than trying to flip a rundown house in a bad neighborhood. Come spend the day with John Dessauer, the nation's leading multi-unit housing expert, and we'll show you how to put tens of thousands of dollars in your pocket over the next 90 days with no money down, no credit, and no risk. Call 800-981-9930 to secure your seat at one of the 3 convenient dates in the Phoenix area. Become the expert in the art of the multi-unit deal. You'll learn how to buy, hold, and sell multi-unit properties with no money down, no credit, and no risk. This class is worth thousands of dollars, but free to the first 30 people to call. You risk nothing, but have everything to gain. Call 800-981-9930 to secure your seat. This class is free to the first 30 people to call. Change your life now and learn the art of the multi-unit flip with no money down. Call 800-981-9930. That's 800-981-9930. You don't want to miss this. Call now.
Did you know the Farmland Index has outperformed the S&P 500 over the last 15 years? That's why you should visit farmfolio.net to discover how Farmfolio is using tangible assets in farming and agriculture that may help diversify investment portfolios. Visit farmfolio.net for information on this dynamic market and learn about Farmfolio's Farm Share program. That's farmfolio.net. All material should not be construed as specific recommendations or investment advice. Always consult with your investment professional before making important investment decisions.
Your one blood donation can help save the lives of up to 3 people. Give blood through the American Red Cross to help hospital patients. Call 1-800-RED-CROSS or visit redcrossblood.org today.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress HomeCare Solutions, Bob Roth.
Welcome back. You're listening to Health Futures. I'm your host, Bob Roth, and we are on our 3rd segment. If you're just tuning in, the first 2 segments, I had Melanie Heffelman from United Healthcare, Medicare, and Retirement in Arizona. And we were talking about health plans. We were talking about open enrollment. And if you missed that, I would encourage you to go to our website at cypresshomecare.com and check out those first 2 segments. And today, on the second half of our program, I've got a return visitor, somebody that is a great contributor to our show in the past, and I know you will be today, is Dr. Troy Comstock. He's with Optum Care Arizona. And they are a network of primary care physicians, specialty doctors, and hospitals that provide Medicare-eligible patients with personalized, and I want to underline that, personalized and collaborative medical care. See, I'm thinking about Medicare because it's open enrollment.
It's on the mind.
Yep. It is on the mind.
No worries. No, yeah, actually, thank you, Bob. I'm an internal medicine specialist as well, so that's primary care for adults.
Yes,
and board certified in that. So it's a great organization to be a part of. OptumCare is taking care of patients all over the valley. Not only do we have our network, but I'm proud to say that we've opened community centers. One in the Goodyear area, one in Chandler, that has really that holistic approach to healthcare that you were talking about earlier, that preventative approach. We have workout facilities, community centers, just looking at mind, body, and spirit, as you mentioned before, just wrapping it out.
Well, and as I said before, too, healthcare is changing, and it's changing by the moment, and you really have to be thinking outside the box.
Yes.
And really stop thinking about it as sick care. And I give OptumCare a lot of credit because that's what you guys are doing. You're thinking about how we can make people better and make them well. And I shared with you before that I had a chance to go up to your location. I think it's right up there by Deer Valley. And watching our older adults, 65 and older, do mind, brain, physical exercising, just wellness stuff, which is really, really cool. And speaking about wellness, it's hard to believe it's almost the end of October. Halloween's coming up on Monday, and this is our last show for the month of October. But we are entering into a time of year where we have influenzas, we have colds, we have flus, we have so much stuff that is going on. And I'm so glad that you're here on the show because I'm hoping that you can maybe help clarify the difference between what is a common cold and what is the flu. And I know this, being a provider of care to older adults, I mean, flu, it can be a killer for older adults.
Yeah, unfortunately, influenza, which is the virus that causes the flu, seasonal flu, if you want to call it that, is very deadly, can be deadly, especially to those most vulnerable people. So the older adults and the younger kids. So those under 5 or over 65. Those for the over 65, especially those that have chronic diseases like diabetes and emphysema, COPD, any of those that really make them even more vulnerable. So, yes, it's an important topic to discuss.
And I really think, and I want to talk about the symptoms of each in a second, but I really think that if you really do a good job of living a healthier lifestyle and really building up that immunity, you can prevent and ward off a lot of this stuff that is easily communicable.
Absolutely. No, the immune system certainly responds positively to having a good nutrition status and exercise. Sleep is also incredibly important. Just as we talked about many times on the show, socialization, even though, of course, you want to be careful around people who are sick this time of year.
Right.
But just being involved in a community, just watching out for each other, it's absolutely important to your health.
No doubt, no doubt. And you mentioned a couple things. You mentioned about exercise. You mentioned eating and sleep. I mean, those are really critical to living that healthier lifestyle.
Absolutely. Yep.
It's interesting because, we've had on the show many months ago. Actually, it was actually a couple years ago. We had Dr. Michael Bruce, who's known as the sleep doctor. Sleep is probably one of the biggest contributors to a healthier life. If you can get a good night's sleep, everything does really well for you.
Without question. As I said, the immune system, the brain, just our overall well-being, depression, anxiety, all of those can be related to sleep or lack thereof.
So let's jump in. Let's talk about cold and flu. Talk to me about the symptoms. How are they different?
Well, a cold it really is just the description of a virus that hits the upper respiratory tract. So that usually the nose or the back of the throat, leading to just the runny nose and the cough, congestion, feeling a little bit miserable. Usually lasts 3 to 4 days. Then you get over it. It is completely different from influenza. And if you've ever experienced having the actual influenza, the flu, you'll never forget. And I have too. So we're both survivors. It gives
and by the way, I think that's a great term, survival.
Yeah.
Survivors. I mean, because you really feel like you're knocking on death's door.
Yeah, exactly. So that's what the symptoms are different. How the symptoms are different is that with influenza, you get the same kind of congestion, the runny nose. Usually there's more cough, a fever associated with it, headache, nausea, and you just feel like you've been hit by a bus. I mean, you just feel knocked out. And it can last up to 7 to 10 days, 2 weeks in some cases. And it can make you very, very sick, bedridden usually. So it's very high risk, especially in those people who are most vulnerable.
And, you think about it, and the couple times I've had it a couple times. I mean, my organs hurt.
Yeah.
My joints hurt.
Yep.
Everything
Back
hurts.
hurts, yes. It really does. It really knocks you for a loop.
So, you've done a good job of really helping us, differentiate between the common cold and the flu. So let's talk a little bit about flu shots.
Yes.
Because, and different strains, too.
Mm-hmm.
Because sometimes, they can do a pretty decent job of matching up the shot to the strain that does come on that season.
Mm-hmm.
You an advocate of flu shots?
Absolutely, I'm an advocate for flu shots. As you said, the World Health Organization and the CDC monitor these strains of influenza virus as it travels around the earth, and then so it gives us a good prediction on what we think is going to be that strain that's going to be most active for that season. Getting the flu shot is absolutely essential, especially in these people, in all of us really, but especially in those people who are most vulnerable. There is a nasal spray that is available, but that's not recommended for this year.
Right. I heard that.
Yeah, and I think there's been some complications with the nasal spray. Especially in those who are what we call immunocompromised, where their immune system isn't as robust. So it's really off the table for this year. It shouldn't be given.
But, you talk about the influenza shot. I'm assuming, because I know this from my own health plans, most health plans pay for this.
Absolutely.
So it doesn't cost you any money.
It doesn't.
And yeah. I know at the CVS that I go to, they give it to you right there. So you don't even have to go to the doctor's office.
Right. Absolutely. Target gave my wife a $5 gift card for getting a flu shot there. So, I mean, it's out there.
Right.
There's really no great excuse for not getting it.
So you really don't have to scour the county or the cities to find it. I mean, we should be diligent to do it and do it now. And that's what I want to talk about. We're coming up on a break. Troy, when we come back, I want to talk about, when is a good time to get this.
Sure.
And then I want to talk to you about a couple other things that HomeCare Arizona is doing. So you're listening to Health Futures, Taking Stock in You. We're down our third segment. I've got Dr. Troy Comstock in the house. We'll be right back right after this quick break.
If you've ever thought about investing in real estate, but you haven't because you just aren't interested in the typical hassles and headaches of real estate, then don't touch that dial. For over a decade, Investment Property Experts has been helping investors take advantage of the growing Metro Phoenix real estate market through a unique offering of turnkey real estate investment services. Investment Property Experts eliminates the hassles and headaches by providing a full inventory of single-family homes that are fully renovated and occupied with tenants. IPX manages the property for you during the time you own it. And when the time comes, they can help you get it back on the market and facilitate the sale. And if you'd rather not purchase and own investment properties, Investment Property Experts offers a guaranteed 9% return through deed of trust investment programs. Real estate market conditions in Phoenix have never been better. And with Investment Property Experts on your side, you'll be able to diversify into profitable real estate investments right from day one. Investment Property Experts, your true one-stop shop for real estate investing success. Get started by visiting azipx.com.
I'm a college student and could use advice about my student loan.
I had to leave school and go to work. Now I have to pay back student loans for a degree I don't have. Fortunately, I found assistance.
Back in college, I figured they wouldn't lend me more than I could easily pay back.
Boy, was I wrong. Thankfully, I got the help I needed to pay back my loan in full.
Sound familiar? The good news is that student loan repayment options are available. We're the NFCC, the National Foundation for Credit Counseling, a nonprofit organization with member offices nationwide that provide comprehensive financial reviews and student loan counseling. NFCC certified consumer credit counselors provide one-on-one financial counseling and can help you evaluate options for making student loan payments, reducing interest, debt consolidation, or even loan rehabilitation. Call 877-406-6322 or visit us online at studentloanhelp.org.
High returns on your investments? Who wouldn't want that? This is Sinclair No, with a strategy that could increase your overall return on your investment portfolio. It's called Decadian. The Decadian investment methodology encompasses a 10-year goal for financial freedom, plus something that's really missing today, straight talk, so you know you have a financial advisor you can trust. Great investment recommendations that far exceed what your institutional markets offer. All this wrapped with performance guarantees. Only those who know what they can do will guarantee what they can do. Decadian. Decadian.com. Decadian. That's Decadian.com. Call 844-332-2342. 844-332-2342. Here for you when you need it most. Decadian.
Your one blood donation can help save the lives of up to 3 people. Give blood through the American Red Cross to help hospital patients. Call 1-800-RED-CROSS or visit redcrossblood.org today.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress HomeCare Solutions, Bob Roth.
Welcome back. You're listening to Health Futures. I'm your host, Bob Roth, and if you're just tuning in, we're on our 4th segment, and I've got HomeCare Arizona in the studio, and I've got Dr. Troy Comstock here with me, and we're talking about flu. Influenza is the formal name that they give it, and we were talking about the differences between the flu and a cold. And we were also, when we left off, we were talking about where you can get immunized. And we were talking about the drugstore. You can get it done at your doctor's office. Any other place? You were mentioning Target.
Yeah, no, I mean it's all over the place. Usually a pharmacy related to it, but they're everywhere.
You know, one of the things that I do want to talk about, Troy, is that there are a lot of these theories that are out there, and you know, one that comes to this this shot that you get is that you might get autism or you might get sick. Let's talk a little bit about that, because you know, we really need to make sure we safeguard our vulnerable population. You talked about kids, but we're also talking about older adults.
Right. Yeah, absolutely. So the influenza immunization is really for kids 6 months or older, and then in any other population. Where there have been some myths, frankly, put out there has been a link to autism for influenza injections, and that has been debunked. So the one study that came out was essentially fraudulent and redacted. There are also some concerns that the injection or the immunization gives you the flu, and that's not the case. I mean, the injection is actually just a bunch of proteins that the body can build up an immune response against. It's not a live virus. And so any type of reaction, yeah, you can get some pain, obviously, from the injection, feel a little bit down. But the fact that you get sick after that usually is because you have a virus that causes you to be sick. And usually the injection is not 100% effective. We'd love for it to be. But there still is a chance that you could get influenza after receiving the immunization. The studies have shown that you don't become as sick, you don't have as severe symptoms potentially if you do get the injection.
You know, it's interesting you say that you're actually getting injected with live proteins, because I've always thought, and I think probably the mass majority of my listeners here think, that you get injected with the virus.
No.
I mean, I've always thought that.
So the nasal spray is what they call a live attenuated. Means that it's a live virus,
right?
But it's stunned or it's not as virulent or infectious. But the injection is actually not the virus. It's certain proteins that are key to the body building up immunity.
All right, so it's October 28th, and my listening audience and myself are wondering, so when do we do this? We're getting into the fall season. It's 96 degrees or whatever out, so it doesn't really quite feel like the fall season, but the evenings are getting good, and the mornings are even more delightful, but we are in it now, aren't we?
Yeah, I get it now. Get it yesterday. The flu season actually starts November 1st through the end of April of the next year. But I tend to say just get out there whenever they're available and get the injection. Some people are concerned about it getting too early or you getting them too early and the immunity wearing off. And that may be true. If really right now is about the right time to get it. But frankly, getting it versus not getting it or forgetting, just get it.
Just do it.
Just do it.
Just do it. Just like the Nike ad.
Exactly.
And Nike didn't pay us to say that, but we're here promoting getting a flu immunization now and do it right now. I have to ask you this question because I think it's more maybe fear-mongering that goes out on the media. We've heard of the swine flu and the avian flu, the bird flu. Anything out there on the horizon that we should really be worried about this year?
Not that we know of, not that we've been prepared for. And the swine flu was really big, I think 2009, but that hasn't been as big. There was a pandemic. It was worldwide at the time. Avian flu, yes, it's definitely out there, but not in the United States, certainly not in this region. So nothing that we can talk about here.
All right, so let's talk about what we can do beyond getting a flu shot. What can we do to protect our vulnerable adults? I mean, obviously washing our hands is very
Without
important.
question. Washing your hands, making sure if you sneeze or cough that it's protected. Frankly, if you're sick, wear a mask. That's kind of taboo or you don't feel comfortable with it, but it's absolutely essential. Just practicing adequate hygiene, staying away from those who are vulnerable when you are sick is absolutely essential. And then from there, if you do start having the symptoms and you are in that vulnerable population that we talked about, it's really important for you to get medical care, to get checked out. Usually you want to do that within 48 hours of your symptoms starting. And the reason why is because some of the medications that are available, there are some medications that can be taken by mouth that can treat the influenza virus and decrease the length of time that you have symptoms as well as decrease the severity of those symptoms.
So within the first 48 hours, and you said this on the last segment, it can last up to 2 weeks?
Yeah, it can last up to 10 days and 2 weeks.
Wow.
And the real problem can become with the complications after influenza, so pneumonia from a bacteria source, not just from the influenza or some of the other really bad things that can happen following the illness itself.
All right, so you're talking about treatment within the first 48 hours. Troy, where do you go? You going to the ER?
Well,
where are you going? You going to your family doctor?
Absolutely. This is the time to be proactive. Talk to your doctor. What do I do if I can't get in to see you? Where do I go? First point of contact needs to be your primary care physician without question. I would highly encourage the second place to be would be the urgent care. They are set up with influenza detection. They can test you there. They can treat you. The emergency room is a place that you really don't want to have to go unless you're desperate. There's nowhere else to go. The reason why people are sicker there, it's more expensive care. People tend to wait longer, and no better place than your primary care physician.
No, I like hearing that, and certainly how contagious one is. And I know that when my children were young, the pediatrician had a sick waiting room and one that was a healthy waiting room. And I mean, realize that you are highly contagious wherever you go You need to protect yourself, but you also need to think about you being maybe that other person where those people are sick.
Absolutely. You're absolutely right. And typically, you're okay as far as not passing on the virus if you've been without a fever for about 24 hours. So that's usually the safe time.
No, that's really, really good to know. And, at the end of the day, I mean, we need to practice good hygiene, need to wash our hands. We need to, like you said, if you sneeze or cough, one of the things I learned a long time ago was you do it into your sleeve, into your where your elbow is, right?
Right. Perfect.
And any other tips to the trade that you can share with our listening audience?
You know what? Those basic things have been around forever. There's nothing else magical.
Sure.
And so I say that if we all practice that, then it's been shown to decrease incidence of influenza.
And I think the last point I want to make this appeal to our listening audience is that if you do have this illness or someone that does, you need to be mindful of those people whose immune system might be compromised, somebody that might be fighting off an illness or might be might be battling cancer.
Absolutely.
They are highly susceptible to this. And like you said, one of the byproducts of this is having this, especially for vulnerable adults, is the risk of pneumonia.
Right. Absolutely.
Well, Troy, I've got maybe just a couple minutes here just as we close. Any closing comments, thoughts you want to share with our listening audience about OptumCare?
You know what? We continue to grow. We continue to expand. And we just continue to do great things. I mentioned it earlier. We opened some new community centers, and I highly encourage you to seek them out. They're on our website as far as locations. But Goodyear and in the Chandler area, they're picking up steam. We have a lot of people. You don't have to be a member to go in and check it out, become part of the community there. If you are a member, we can do annual wellness exams. We can do preventative visits at least as well. So it's a lot of fun. I hope you come and check it out.
No, and it's not sick care. It's well care.
It is well care.
And if you need to look them up, go to OptumCare.com. That's OPTUMCARE.com, or call them at 877-901-4979. Dr. Troy Comstock, thank you for being on the show once again.
My privilege. Thank you.
Have a great day, and make it a great weekend. We'll be right back at you in November. November is National Family Caregiving Month. Take care now.
There's no place like home. You've been listening to Bob Roth's Health Futures. If you have questions about your own or your loved one's future health care, call Cypress HomeCare Solutions at 602-264-8009. That's 602-264-8009. Or visit CypressHomeCare.com. Be sure to join Health Futures with Bob Roth every Friday at noon, right here on Money Radio 1510 and 99.3 FM.
Right after Business for Breakfast, right after the news on Money Radio, tune in Mastering Money with wealth manager Steve Jurich and the doctors Sinclair No. Learn about cutting-edge retirement investment strategies, Social Security optimizing, and RMD strategies. Guests on Mastering Money have included Steve Forbes, Larry Kudlow, and the one and only John Bogle, the founder of Vanguard. Join the A-Team, Steve and Sinclair, mornings Monday through Friday at 8. And now, download the Mastering Money app for your Apple, Android, and Windows devices.
Money Radio 1510
and 99.3 FM.
Is KFNN Mesa Phoenix and K257 CD Phoenix. The beautiful Westin Kierland Resort and Spa is this year's venue for Financial Fest, the full day of free ideas for smart investing. We'll see you Saturday, November 19th, starting at 8 in the morning. Right now, the Dow is down 15 points, the S&P 500 down 7, and the NASDAQ down 28 points.
When people want to talk about money, this is the place they come to. And there's more on the way after this break for the latest news.